Therefore, the idea is do the hepatocyte transplantation, and immediately after the birth, once a diagnosis is made, then we give the hepatocyte cells in the body. Then those hepatocytes usually was given into the liver. And then these new cells, they nest in the liver and then start making the normal functions. Since they are not, they don't have the enzyme deficiency, they are going to take care of this enzyme deficiency in a way that we are going to prevent these metabolic crises. And as I give as an example, that ammonia level is not going to go to sky high, that we are going to protect their brain. So then they can be a candidate for transplantation while they are waiting. Since we don't have any metabolic crisis, we buy time. Then we will be doing this transplant successfully before brain injury. Then after transplant, that they can be a complete, full, functional individuals, and that's the advantage of hepatocyte transplantation. We've seen in patients, and 1 month after birth, and they die with the ammonia crisis. Some of them, especially in old days, and many of the unknown deaths in the newborns, some of them related to these metabolic genetic problems, and that happen. Now we do, all newborns are tested for certain metabolic, the studies. Then some of them we capture them very early. Some of them, they show some symptoms of the problem, that some abnormal, behaviors. Some, sometimes you cannot wake the kids up. Then, you have to make it takes more time. Sometimes they smell the odor, then the family gets gets nervous, and then they seek for the medical advice. Sometimes, and just the routine baby checkup. The family comes to routine baby checkup. 1 month or so. We found the baby is certain things wrong. Then we start doing the workup. So that's the way we dialysis. Okay. Meanwhile, performing the hepatocyte transplantation, that will be bridge to liver transplantation. Why we need a bridge, you may ask? Why we need to go to directly to transplantation? For 2 reasons. A, operating on the very tiny kids is really difficult because their vessels, and because when we do liver transplant, we have to hook up the vessels. Then, since the vessels are really tiny, it is extremely difficult to perform these surgeries successfully. Then, if kids is 2 kilogram and very tiny, then operation is difficult. But if kids or one kid, if he or she reaches the, let's say, 10 kilogram or 15 kilogram body weight, then vessels and all the structures are going to grow appropriately and proportionally. Then surgery will be easy. The second issue is finding matching organs to tiny babies is extremely difficult. That requires more complex surgeries, that invites more technical problems, and the success rate will be affected. On the other hand, if kids grow and they reach a certain size, finding organ and performing the operation successfully would be easier. Then that's why we call the hepatocyte transplantation as a bridge to solid organ transplantation, which means that changing the whole liver, giving that individuals a new liver.